Dr. Megan Gowda. I work with Virginia Urology Women's Health. I come from a gynecology background, so I did my residency in OBGYN and then did my fellowship in female pelvic medicine and reconstructive surgery.
My name is Dr. David Glazier. I work at Virginia Urology's Women's Health. I have done a urology residency and fellowship in urology and also board certified in female pelvic medicine and reconstructive surgery.
So I think one of the strengths of our team is that we come from slightly different backgrounds, being from gynecology and from urology, but we work together at Retreat Hospital to perform minimally invasive surgeries for incontinence and prolapse, and we truly do work as a team.
And doing this enhances patient care and outcome.
Incontinence refers to any leakage of urine, whether it's happening when you're exercising or laughing or coughing or sneezing, or sometimes some women come in and they just can't get to the bathroom on time. There's no warning time. Either way, we really do start off with a minimally invasive approach. Sometimes that involves physical therapy or medicine or injectable medicines, and if those things don't work, then certainly we can talk about surgery. Prolapse and incontinence are common, but they're not necessarily normal parts of aging. They can have a tremendous burden on quality of life. I think that one of the major barriers to care is the perception that all of these problems require surgery, or that if you were to have surgery, they require mesh, and people are definitely scared off by some of the ads that they're seeing on TV. One of the most common questions that we get in the office are about mesh and whether or not we use mesh for all of our surgeries, and certainly that's not the case. We really do go to great lengths to see what your symptoms are, see what your goals are for your recovery, and then really tailor our treatment to those goals. Almost every surgery that we perform for either prolapse or incontinence can be performed without mesh.
Robotic surgery is where we use a robot as a tool to help make very small incisions in the skin. By doing this, we're able to perform surgery at 10 times magnification. The great thing about this minimally invasive robotic approach is there is decreased blood loss and associated with significant quicker return to work and a lot less pain. Our last 30 patients Dr. Gowda and I looked at were not taking any pain pills after a week. In the past, surgery was performed by making a large incision in the abdomen. This would result in a patient remaining in hospital for 3 or 4 days after surgery and would have significant pain and discomfort for at least a month afterwards while they healed. Now, with robotic surgery, patients will go home usually the next day and sometimes the same day, and the pain associated is significantly less.
One of the things I always encourage patients to do is just to come in with their questions and a list of questions and get a handle on what the different treatment options are and see what's available for you. There's no one-size-fits-all approach to treatment, and depending on your symptoms and what your goals are, we would definitely customize your treatment options. Prolapse and incontinence are medical issues and can have a major impact on quality of life.
Don't suffer in silence. There is so much hope. We are here to help.